Well, good afternoon, everyone, and welcome to our COVID-19 update briefing for Thursday, November 12th. Ahead of the holiday season, IDPH has provided recommendations for keeping you and your family safe from the virus, which you've seen and can find on the IDPH website. We're also directing a small portion of our federal COVID-19 response funds to support a new awareness campaign on some of the best ways to have a healthy holiday season. This new campaign, Healthy Holidays to You, highlights what doctors and scientists consider methods to reduce your risk of contracting or spreading the virus. Keeping gatherings small and virtual, maintaining 6 feet of distance from others, and wearing a mask, whether you're indoors or out. We want to show people some of the best ways to reduce risk as determined by epidemiologists, researchers, and modelers. At the end of the day, traditions are so important to all of us, but this year we need to celebrate a little bit differently. You'll see and hear this content on TV and on radio, in newspapers, on billboards, and online, and you could follow it also at All in Illinois on social media to see more of the latest holiday safety tips over the coming weeks. Yesterday, in the wake of increasing case counts and hospitalizations, the Illinois Department of Public Health issued a new set of recommendations for how residents should act in the next 3 weeks as statewide COVID-19 hospitalizations reach, and in many regions surpass, our highest rates from the spring. Dr. Azik will walk through these best practices in just a moment, but our goal here is this. We're asking Illinoisans, no matter where they live, to stay home as much as possible, only leaving for essential activities if you can, like work, if you can't work remotely, school if you're learning in person, getting groceries, visiting the doctor, or getting a COVID test. If you're choosing to travel for Thanksgiving, it is even more important that you take extra caution in the coming weeks. While staying apart and holding a virtual celebration is by far the safest option, if you do choose to have a small in-person Thanksgiving, the safest way to do it is to have every single person in attendance more or less quarantine or come close to it for the 2 weeks prior. So that would start today. Testing is also critical for those gathering, and it should come as no surprise given our current rates of spread that we're now seeing a soaring demand for tests across the state. Even as the third best testing state in the nation, we're now at a place where our state-run community-based testing sites are hitting capacity before the end of their normal operating hours. So over the weekend, we're increasing capacity at our most visited sites, Aurora, Arlington Heights, and Harwood Heights. We continue to build on our testing capability, but as always, we're limited by the speed at which the existing public and private lab capacity can grow and by the physical layouts of these drive-through locations. Still, we intend to remain among the best in the nation in testing. Across the state, we're seeing increases in the number of people showing up at hospitals with COVID each day in every single region. And every single region has a positivity rate in the double digits, none lower than 12.5%, and that's in Region 5, Southern Illinois. On our Wisconsin and Iowa borders, 2 states that are seeing positivity rates of nearly 40 and 50% respectively, Region 1 is now up to an 18.9% average positivity rate, the state's highest. Over just the last 2 weeks, we've seen statewide increases in every single measure, from cases to positivity, to hospitalizations, to ICU visits, to ventilator usage, to deaths. I want to close today by talking about a topic we've covered during a number of these updates, and that's the role of local officials in our pandemic response. Earlier this afternoon, the city of Chicago put out a stay-at-home advisory to residents starting Monday encouraging them to avoid all trips outside their home, aside from work and school, and all private gatherings inside residences. The city also implemented a new indoor and outdoor gathering cap of 10 people, along with an enforcement mechanism as our hospital systems face down this new wave. So I want to commend the mayor's decision, because it's never an easy one to make, but it's the right one. I should also note that the city of Chicago is doing better than the rest of the state right now when you compare its current hospitalization levels to those in the spring. So let this be a model for action for the rest of the state. Earlier this week, Sangamon County and the city of Springfield announced that they would reverse course and adopt IDPH mitigations. Enforcement of those mitigations will begin tomorrow, more than 2 weeks after Region 3, home to Sangamon County, reached the metrics to require them on October 29th. On that day, the region reported an 8.8% average positivity rate. Well, it's now at 16.4% today. The average number of people coming into Region 3's hospitals for COVID-19 was 11 per day back then. It's 23 per day now. That's a 109% increase. I commend the leaders in Sangamon County and Springfield for taking this step in the right direction, because simply put, there's just no time left to waste. There are other leaders in Champaign, Urbana, and Carbondale, for example, who over the course of the last few months have taken decisive action in attempting to stay ahead of the increasing community spread of the virus, and they deserve to be commended. To the elected officials who have chosen to disregard public health guidance, those who have stood up at press conferences to question the data and fuel conspiracy theories, those who have taken their absurd crusade to the courts and lost nearly every single time, those who have flat out told the businesses in their communities to ignore what their local and state public health departments and experts, some of the best in the nation, are telling them. What is it going to take to get you to be a part of the solution? Dr. Azik and I have stood up here every day telling you the facts. We've had dozens of the nation's leading experts present and giving you the information, their epidemiological information, their modeling information. They've stood here with us to show you how bad things can get. We've given you the data here in Illinois and the best studies from across the nation and the globe. We've shown you what this looked like in the spring and how this wave is already worse than that in many regions of the state. What will it take to make this real for you? Do we have to reach a positivity rate of 50% like we're seeing in Iowa today? 50%? Are you waiting for healthcare workers to get sick to a point where you don't have enough staff in the local hospital to cover the next shift? What about if the hospitals become so overrun that you're sick and you're dying have nowhere left to turn? Because I promise you, while you fail to take responsibility in your city and your county, that day is coming closer, and it will be on you. Meanwhile, the rest of us will still do our jobs. The state will do all that it can to help hospitals surge their capacity and find additional staff. Healthcare workers will take up their posts on the front lines as they have every single day since this began. But more people will get sick, more people will struggle to breathe, and more people will die because you've failed to do your job. While good people do the right thing by wearing masks to keep each other safe, elected leaders in some communities have allowed others to infect their constituents because they're afraid of the few loud anti-maskers, or because the elected leaders themselves are anti-maskers. In too many of these communities, responsible business owners have followed public health guidelines, only to see competitors flout the rules and prolong the mitigations for everyone else. There may be a vaccine on the way in just a few months, but a lot of lives can be saved before that happens. And when this is over, there will be an accounting by your constituents of who worked to keep the public safe and who just ignored the science. This is the moment to step up and get it right. Winter is coming. Folks, I've pledged to be honest with you throughout this COVID crisis, and that won't ever change. We're running out of time, and we're running out of options. Our growth in new cases is now exponential. We are seeing current numbers and future projections worse than what we saw in the spring. We're more practiced at responding to this virus now, so we have significant stockpiles of PPE. We have overflow capacity that's already planned by our hospitals, and we have much more testing available. But that won't slow the spread of the virus. Since the stay-at-home order ended in May, we've allowed local governments to make decisions about whether they needed tougher mitigations and enforcement, and we've only imposed certain select mitigations at the state level on a regional basis. Those tools worked where people acted responsibly in local communities. But with many community leaders choosing not to listen to the doctors, we are left with not many tools left in our toolbox to fight this. The numbers don't lie. If things don't take a turn in the coming days, we will quickly reach the point when some form of a mandatory stay-at-home order is all that will be left. With every fiber of my being, I do not want us to get there. But right now, that seems like where we are heading. If you're sitting at home and wondering what you can do to help prevent this and to stop the spread, well, wear your mask when you're out and stay home if you can. And while you're home, give your county board chair or your local mayor a call. Ask them what they're doing to enforce the doctor-recommended mitigations. Ask them what they're doing to keep you and your loved ones safe. And with that, I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Azik.
Good afternoon. I hope people were able to celebrate veterans and thank a veteran for his or her service and dedication to this country. For those veterans who now live in the state of Illinois and in one of our veterans' homes, I would like to offer assurances that the Illinois Department of Veteran Affairs and IDPH are working together to do all that we can to protect the health and safety of our heroes in our veterans' homes. Long-term care facilities, as you know, are high-risk settings. They're high-risk settings for all kinds of infection transmission, with COVID-19 being no exception. And unfortunately, our veterans' homes here in Illinois have seen outbreaks. LaSalle is reporting a total of over 150 cases since the beginning of this pandemic. That included 82 residents and 9 deaths. The Department of Public Health, the state team, is on site right now to provide technical assistance and consultation to that location. The Quincy home has reported over 80 cases since the beginning of this pandemic, and that has included 1 death. Manteno has reported over 100 cases of COVID-19, including over 15 deaths. The Prince home, which is separate from Manteno but on the same campus, has also reported 7 cases. And Anna is reporting 13 cases, of which 6 are residents. Testing continues, and as we understand how this virus works, we unfortunately can expect to see additional numbers added to these counts. In March, at the beginning of this, Veterans Affairs did institute visitor restrictions just similar to the ones in the long-term care facilities and the nursing homes. And this was all to help reduce the opportunity for the virus to be introduced into the facility. There were pre-shift screenings, and those continue to occur for both employees, and residents are monitored daily to look for symptoms of COVID-19. Also in the homes, negative pressure rooms have been established. Staff are routinely tested, and the Veterans Affairs is ramping up the use of the antigen test in order to get results even more quickly to act rapidly. Please understand that it's impossible to have a COVID-free veterans home, a COVID-free school, in the midst of a COVID storm. And that's what we have in our community right now. We in the community can help, as the governor iterated, we can help protect our veterans by reducing the amount of virus that's circulating in the communities. Healthcare staff who work at the homes, they're in the community with you. They're buying groceries, they're running other essential errands, and if disease transmission is just rampant, then those individuals that work in the homes can get the virus and unfortunately spread it to our heroes. If we can decrease the exposure to the virus in the community, we will do the right thing by our veterans. Today we are reporting 12,702 new cases of COVID-19 for a total of 542 total cases in Illinois. We have received word of another 43 deaths for a total of 10,477 lives lost. Overnight, 5,258 people were reported to be in the hospital. Of those, 956 were in the ICU and 438 on ventilators. Please note that 5,258, we never saw that number in wave one. This is an all-time high, and I am telling you that that number is only going to increase based on the numbers of cases that we've identified for the last several weeks. In the last 24 hours, 100,617 tests were reported for a total of 8.7 million tests. Yes, we are the #3 testing state in the nation, but testing alone is not going to end this pandemic. It still requires the individual responsibility and actions of every one of us to curb the transmission. I cannot express strongly enough the seriousness and the urgency of the spread. Every metric we have, the cases, the hospitalizations, the ventilator use, the deaths, they're all going up. We are in this exponential growth of cases. So you will see that we quickly have gone to 5, to 6, to 7, to 8, to 9, to now these numbers that we never thought possible. So that is how you get to 50% if we don't do something now. That's why over the next 3 weeks, Public Health is recommending that people who are able to work from home do just that. We ask that people stay at home as much as possible. Go out only when necessary, and don't take the whole family and friends. Minimize the number of people that are out, whether it's to buy groceries. Of course, if you have to go to work, if you can't work from home, just do what's mandatory, what must be done. We're also asking people to postpone or avoid gatherings and travel. With the rising prevalence of this virus, attending even the smallest gathering that mixes households or traveling to surrounding areas, that increases the risk of further spread of this virus. Again, our goal is to reduce transmission. It's always been that goal, but especially as we head into the holidays, so that businesses, so that schools, so that our veterans' homes can be safe. Please protect yourself and protect others. The masks protect you and they protect others. The CDC has just come out with much clearer guidance on that. Continue to wash your hands, watch your distance, and wear your mask. Thank you. Buenas tardes a todos. Espero que celebraron el Día de los Veteranos y dieron gracias a todos los veteranos por su servicio y dedicación a este país. Para los veteranos que ahora viven en uno de los casos de veteranos en Illinois, me gustaría ofrecer garantías de que el Departamento de Veteranos de Illinois y IDPH están haciendo todo lo posible para proteger su salud y seguridad. Los centros de atención a largo plazo son entornos de alto riesgo de transmisión de COVID-19 y lamentablemente nuestros casos de veteranos en Illinois han sufrido brotes. La SAL está reportando un total de 170 casos desde cuando empezó la pandemia. 82 son residentes y incluyen 9 muertes. Quincy informa 86 casos, 15 son residentes y incluye una muerte. Mantino está reportando 108 casos de COVID-19, 61 son residentes y incluyen 17 muertes. Prince Home está separado de Mantino, pero en el mismo campus, y informa 7 casos, 3 residentes y 4 empleados. Y Ana informa 13 casos, 6 son residentes. Las pruebas continúan con resultados pendientes. Estos son números provisionales, puede aumentar. En marzo, Asuntos de Veteranos instituyó restricciones de visitantes para ayudar a reducir la posibilidad de que el virus se extienda en estos lugares. Implementamos evaluaciones para los empleados y vigilamos los residentes diariamente para detectar síntomas del COVID-19. Los trabajadores se hacen pruebas muy frecuentemente y los asuntos de los veteranos están aumentando el uso de las pruebas antígenos en los casos para realizar pruebas más rápidamente a los residentes y a los trabajadores. Pero nosotros en la comunidad también podemos ayudar a proteger a nuestros veteranos por reduciendo la cantidad de virus que circula en nuestras comunidades. Si podemos bajar la exposición de los trabajadores al virus en la comunidad, podemos ayudar a evitar que nuestros veteranos no estén expuestos al virus. Hoy estamos reportando 12,702 casos nuevos para un total de más de 536,000 casos aquí en Illinois. Eso incluye 43 muertes adicionales para un total de más de 10,400 vidas perdidas. 5,258 personas estaban en el hospital con COVID-19, de ellos 956 pacientes estaban en la unidad de cuidados intensivos y 438 estaban en ventiladores. En las últimas 24 horas, 100,000 pruebas fueron hechas para un total de más de 8.7 millones de pruebas aquí en Illinois. No puedo expresar la seriedad y urgencia de la propagación de COVID-19. Cada métrica que tenemos, casos, gente en el hospital, uso de ventiladores, muertes, todo está aumentando. Es por eso que durante las próximas 3 semanas, IDPH recomienda que las personas que pueden trabajar desde casa lo hagan. Pedimos que las personas se queden en casa tanto como sea posible y solo salgan cuando sea necesario para comprar alimentos, ir a trabajar si trabajar desde casa no es una opción. También pedimos a la gente que no se junten en grupos grandes o viajan. Nuestro objetivo es reducir la transmisión a medida que nos acercamos a los días festivos para que los negocios y las escuelas puedan estar abiertas y seguras. Por favor, protégese y proteja a los demás. Lávese las manos, mantenga su distancia y usa su máscara. Muchísimas gracias para su apoyo, and with that, I'll turn it over to Governor Pritzker.
Thank you, Doctor.
So, Governor, are you going to wait the 3 weeks that you've asked everyone to stay home, don't travel, only go to work if you have to? Or if in the middle of these 3 weeks, the numbers are even worse, will you interrupt those 3 weeks and say, okay, sorry, we're having to stay at home now?
This is definitely something we're monitoring day by day. You know, as you know, I look at these numbers every day and several times a day. And so it is absolutely possible and certainly likely if the numbers keep going in the wrong direction, that we may have to take more stringent action.
And will it be based on cases, hospitalizations, ICU, ventilators? What's it going to be based on?
I mean, the answer is we're still working on that, and certainly I'm talking to the experts, IDPH and even outside experts, to make sure that we're using all the right metrics for this. But you've seen the metrics that, generally speaking, we're using. Hospitalizations has always been a part of this. Positivity rate does make a difference. The sheer number of cases, which, there's a certain percentage of which end up as hospitalizations, is not a small factor here. But we use positivity rate and hospitalizations typically as a way for us to measure, actions that need to be taken.
Governor, what's
Yes.
the status of McCormick's place? Was that totally taken down? Is it being ramped back up? Are you going to use it again?
It's not currently being ramped back up. I've been in very close touch with the hospitals and getting information from them about their bed availability and their staff availability. Remember, just having a space, Craig, doesn't mean that you've got the ability to treat people, right? You need nurses, you need doctors. And oh, by the way, with the states around us doing even worse than we are, there's big demand in those states for healthcare personnel. So we're working hard to try to reserve staffing, working with the hospitals who really are the front lines of, they know how to surge capacity for staffing, but I'm monitoring that closely.
Do you blame surrounding states for this surge? Because yesterday, I think you misspoke when you said if you run into two Iowans, the likelihood of one of them having COVID, there's 3 million people that live in Iowa.
And not everybody's getting tested, right? Right, but as you know, when you're talking about a 50%, you're right. I was being hyperbolic yesterday, but it's to make the point that we don't want to get to 50%. That is really problematic, and that it is true that where you have higher positivity rates, it is more likely that more people. If you go meet with 10 people or 100 people, goodness sakes. I hope you're not meeting with 100 people, but if you go into a crowd of 100 people, you're much more likely to be exposed to quite a number of people in that group in Iowa who have tested positive or who are positive for COVID-19.
So, Governor, what mitigations are you looking at taking? Will we go to a full-on shutdown like we were back in the spring?
We're working on it, Craig, and as I've said for a few days, we're looking at all the mitigations that we've considered over all of this time. I think we're better at thinking about these. We know a lot more now about what works better, what doesn't work as well. And we're obviously taking all that into consideration. But I promise you that if a decision gets made that we would do that we'll be, make sure and foreshadow it or announce it and with enough time so you'll understand.
Back to the talk about other states. Yesterday, Indiana, they still have indoor dining. They still have a lot going on. And I believe there's some video of a party in Hobart with hundreds of people that Univision has been working on a story about. They've asked me to ask you about. When you see those kinds of things going on, are they doing enough when we have so much stricter rules and they really don't seem to have as many at all?
Right. This is why we needed a new president. This is why we need a national strategy, because the truth is that we don't have fences around our states. We don't want them. We want to make sure that we've all got similar or exactly the same mitigations in place so that we can keep the numbers down. Listen, look what's happened in Wisconsin, right, where the Supreme Court just overruled the governor entirely. There are no rules in Wisconsin. Iowa, the governor has chosen not to impose any rules, as far as I understand. And there are other states like that. But many of those other states don't affect us as much as the ones that are on our borders, and where, as you know, Illinoisans work in some of those states, and people who live in those states work in Illinois. And so, we've got a real problem because we don't have a national strategy.
Governor, let me ask you about why casinos we're talking to restaurant owners today, they're wondering why casinos are open.
Yeah.
We got reports over the weekend that at casinos, people are not wearing masks, they're all on top of one another. And the restaurant owners say, look, how can they be open?
Yeah. I understand what you're saying. As you know, casinos tend to be much wider spaces, much broader spaces. So when you say, why are they open? Look, restaurants are open too, but they've got different configuration because they're outside. You know, we didn't close restaurants. We did ask them to have outdoor dining, tented dining. Some of them have even gotten igloos, you know, for people to sit outside, but remain warm. And so we're absolutely looking at all of those things when we think about the mitigations that we might need to impose.
What about landlords? Can I ask you about landlords for a second?
Sure.
They're in dire straits because tenants have been unable to pay the rent. The landlords still have to pay the mortgages and the water bills and everything else.
Yeah.
What, if any, emergency measures can the state take to offer relief for those landlords?
So some of that will take legislative action because in Illinois we don't have the ability, to a large degree, we don't have the ability to you know, go halfway or to make the kinds of adjustments that I would like to make. And so we're continuing to look at how we will help restore our landlords and their rights. As you know, the whole point here is that we don't want to have a whole bunch of homeless people at a time when we've got COVID, particularly a COVID storm like we've got now. That would really be problematic, and then we're heading into winter, which not only makes that storm worse, but of course the winter weather.
The UK, Ireland, France, Germany, they all have these new lockdowns, but they're not closing schools or universities.
Right.
Would that apply here to the state of Illinois?
Again, we're considering all the options here, but you've seen that I've been trying to protect people going back to school, people being at school as best I can, and you know, making sure that the universities in particular, but also providing guidance for K-12, are doing as much as they can to have, for example, a separated COVID dorm. If people do get sick, they don't go home, right? They can recover on campus, get health care on campus, and so on. We're doing everything we can to keep our educational institutions
We'll do
open.
one more, and then we got to go online.
Could you call a special session? I know the veto session's off, but couldn't, you're the governor, aren't you allowed to?
Yes,
say?
it is. There's no doubt. There's a law that allows the governor to call a special session, but I just want to point out that just because you call a special session in an environment like this where COVID is rampant does not mean that the members would actually show up, and especially because apparently the members have chosen not to.
Craig, you'll be the final one.
I just want to ask a question of Dr. Azik, one of my colleagues, if you could. Can you tell us, Dr. Azik, what is the average wait time for COVID tests to come back, and is there a backlog on those right now?
We follow these numbers every week to see how quickly the labs are coming back for the state of Illinois. We've had weeks where it's 70, 80% of the labs have come back within 48 hours. Obviously, if you're in the midst of a week that has a holiday like this one, and if we've chosen to help give our staff that's been working just furiously the day off, that can affect wait times. So I think the last data from last week, I know 53% of the labs were back within 48 hours. Again, and this includes like from when the swab was in someone's nose to when it was given back, to when the results were given, which is a lot of things have to happen in that time. It went into the nose, it had to be transported to a lab, then the lab had to run it, then the lab had to deliver the results, and then the results given. So 48 hours is really quick, and most of our labs are consistently in the state over that. IDPH obviously has been trying to stay on top of their 48 hours, again, with the caveat that if there's a holiday, that will affect things. We don't really have the control of private labs to make them turn around faster. So if they are taking on too many labs, more than they can handle, more than their actual throughput allows, they may have larger delays. And again, you know, we can talk to them, but it's not something that we can directly control. What I will say, and need to make sure I put it out there, is that when people are swabbing and trying to get those specimens to the lab, because the clock started ticking when the swab was taken, you have to make sure that the swabbing is timed to when the delivery person, the courier, is going to get that. There have been situations in which IDPH got the specimen 2 days after it was collected. So before we received it, we were already behind our 48-hour goal. So, but the turnaround time, again, starts with when it was in the know. So again, making sure that the timing of the collection and delivery is timed so that we can get this around done as quickly as possible.
Craig, if you could have your colleague send me, if you could have your colleague send me an email. The test times require a little more information on where the test is going, if it's a private versus state lab, so I can get you more detailed information if you just have them email me. Thank you. We will go online. Gretchen at WMBD in Peoria, why are people still experiencing long wait times with IDES? What should they do in the meantime?
Those wait times have become shorter and shorter. I just want to point out, we're monitoring those pretty closely. Having said that, we're making sure that people are getting contacted and that we're getting the right information. If there is a wait time, it is something to do with the way that they have applied for it online. Typically, there's some problem in the way or what the information was that they provided. That's no fault of anybody's necessarily, but it does mean that there needs to be some interaction with an IDES agent. So we're working at that as fast as possible.
Okay, we're going to knock out a couple of these IDES ones altogether.
Sure.
Fraud claims are up 1,440% this year over 2019. Do you plan to launch an investigation into the department regarding fraud and why there is so much of it? Why or why not?
Well, thanks to the federal government, there's a great deal of fraud.
And the federal government is also investigating. So.
Yeah, they are, and we've called them in. Every state needs help with this. This is not a unique problem to Illinois. So, we're continuing to pursue people who apply fraudulently. But I must say that our systems now are catching it much more easily. We know better what to look for using data analytics.
Okay. Jake Griffin at the Daily Herald, can we get an update on the state's vaccination plan, particularly regarding any investment in existing inventory of ultra-cold storage units needed for the Pfizer vaccine and how that equipment or resources will be distributed?
Well, there's only been a preliminary study that's come out about that Pfizer vaccine. I'm very optimistic about it. Lots of other doctors, Dr. Fauci, talked about the optimism around it. But there's, investing in 100-degree below zero freezer equipment for the entire state before you even know if that's a vaccine that you will use probably doesn't make any sense.
John O'Connor at the AP, sir, we remote reporters don't get follow-ups, so I'd be obliged if you could answer all parts of our questions.
Okay, I'll try.
Would it be a distraction from your agenda to have Mr. Madigan remain Speaker? If not, why do you not believe that?
Look, I'm going to work with whoever the Speaker of the House is. That's the obligation of the governor, whether it's somebody different or a Republican or, whoever becomes Speaker of the House of Illinois, I'm going to work with them. And I don't get to choose. They do. The members do, rather.
Rich Miller at Capital Facts. For 2 weeks in a row, nearly 10% of all new U.S. unemployment insurance claims have been filed here in Illinois. What is the state's explanation for this, and does the state have a plan to deal with it?
Well, I think I mentioned the other day that we had a huge spike in this PUA unemployment, and a lot of that is fraud-related, we believe, based upon the analytics, and so we're trying to address that. Look, unemployment is never good, no matter what that number is. It's not good. We very much want to continue growing our economy. I have believed from day one that the way you do that is tackle the virus, and make sure that you're doing everything you can while you're tackling the virus to keep people safe in the economy that is up and running and to some degree is continuing to grow from a low that it hit last spring.
Mike Militich, are you considering requests from lawmakers to hold public hearings with your administration regarding the state's response to COVID-19? They stress the General Assembly should have a seat at the table.
General Assembly's had a seat at the table for quite some time now. We have a Restore Illinois Commission that the General Assembly passed a bill to create. There are members of that Restore Illinois Commission. We've had members of our administration presenting to them on a regular basis. I'm not sure exactly what the schedule is, but roughly weekly and biweekly those meetings have taken place. And so there's been a lot of reporting to the General Assembly. We'll continue to answer questions and provide information.
Cole Henke is asking, your eviction moratorium is scheduled to end next week. Do you plan to extend it another month?
Yeah, we'll make a decision about that shortly. Again, I'm looking for ways. I mean, we had an earlier question about landlords, and we're always looking for ways that we can make some adjustments here. I need to go to the General Assembly for the kinds of adjustments that I want to make, but we'll definitely be making a decision in the next week.
Hannah Mizell, Governor, you've made mention of moving back a phase in recent days. I'm fielding a lot of rumors about schools. Phase 4 allows in-person instruction, but Phase 3 does not. I looked at the metrics for Phase 3, and it seems as if they operate in a positivity rate for moving forward to 20%.
So what I was alluding to, I'm sorry to cut off the question, but I think what I was alluding to was simply that we are looking at all of our options here. I think there's nothing hidden here, folks. We are trying really hard to look at all the mitigations that we know have worked and the things that have proven to work, things that have proven to work in other states, by the way. Sometimes it's about limiting the time that businesses might be open. Sometimes it's, as we've seen, closing bars, for example, that is effective. So we're looking at all of those things. It's not that we're, when I say moving back a phase, what I really mean is that there will be more mitigations imposed, and we're going to look back at the things we did in Phase 3, the things that happened in Phase 2. We're going to look at each of the mitigations that we have in the tiers of resurgence mitigation, and we're going to put a package together and come forward with that if need be.
Okay, so Hannah's question was, will you order in-person instruction to be shut down if a region meets that 20% metric?
We're looking at all of it.
Molly Parker at the Southern Illinoisan, can you provide some details about how you're planning to distribute a vaccine to parts of rural Illinois? What challenges do you foresee, and what is being done to overcome those challenges?
I think our plan is online, the plan that we put together for the federal government, so I just commend you to take a look at that plan. We are not leaving any part of the state out. I mean, I am very focused on equity. That is vitally important to me, and that means equity for rural families, for people who live in communities that have been left out and left behind with regard to health care, and equity to making sure that we're getting first to those who are most vulnerable. So that plan, you can take a look at what we did for the federal government, although I have to say they asked us so early in the process that when you don't know what the vaccines are that you're delivering, and you don't know whether you have to keep them in cold storage or whether they're room temperature, it's very hard to put a plan together that meets every requirement of every type of vaccine. And by the way, there's likely to be more than one vaccine that is distributed, and that means there will be more than one supply chain. But we're, trust me, focused on rural Illinois.
She had one more follow-up. Given today's main message from the press conference, if local officials are not able or willing to do more to enforce the mandates, why not dispatch state police to do it?
Well, I think everybody needs to step back and recognize that, just so you get the numbers here, like the city of Chicago has 13,000 CPD officers. The state police, covering a much bigger territory, and 5 times the population, has 1,900 troopers. So there's no way for the state police to do the kind of enforcement that's necessary. When we pass laws and regulations at the state level, we expect local officials that are required to enforce the law to do that. And it's disturbing to me that, particularly in the midst of a pandemic, when people's lives are on the line, that our local officials in some areas of the state are not doing their jobs.
Peter Hancock will be our last question for Dr. Azik. Is it possible that the positivity rates in neighboring states look high because they're only testing high-risk populations, like people with symptoms or those suspected of having been exposed?
I would be slow to talk specifics about another state's testing. I don't know exactly. I know that they're not getting as robust testing as we are. So we are identifying more cases. I would think that if you aren't testing as aggressively as we are, then there are a lot of additional cases that have yet to be identified that never get identified. So again, more testing is obviously better, but I think what's always important is not just the positivity rate, but the trend. And so if your numbers are steadily going up, you know that disease transmission is increasing. If your hospitalization numbers are going up, you know that there's a bigger burden of disease and more illness. And so that's what we can definitively say is happening both here and amongst our neighbors.
All right, thanks, everyone.
Thank you.
Thank you.